All right, everybody. How y'all doing? I'm not gonna be here. I'm gonna get out the way. So we are here with Slim J. Just my opinion. So Slim, I'm gonna get out the way, let you introduce yourself, and then we'll play your intro. And then you come on back and we'll get it started. So
All right. Hello, and thank you for tuning in to Slim J, just my opinion. And we're going to have some knowledge of breast cancer. This is Breast Cancer Awareness October Awareness Month. So let's get you all tuned in. So grab your popcorns, your snacks, or whatever it is that you want. And let's get this party started. Let's get this knowledge.
I like to be educated, but I'm so frustrated. Hello to my loneliness. I guess that ignorance is bliss. Take me back to before I knew. Rewind, take it out of cue. Innocence can be a young man's game. Signed up for the hall of shame. I wish I knew how much I miss not knowing that we're all screwed when we play our roles and ignore the problems. I like to be away in my patience. Stay up, I feel so outdated. How can we look the other way? Sun is out, but the sky is gray. What would happen if I took a chance? It's always hard at first glance. I don't wanna, but I know I gotta do it. The truth is hard to swallow. I think I'll chew it. I wish I knew.
Hi, everyone. Thank you all for tuning in with Slim J, just my opinion. Uh, Today's topic is Breast Cancer Awareness Month. We have lost a bunch of people from breast cancer. We have also have had people to survive breast cancer. Um, Going to see if we got some more people tuning in, trying to give y'all a little time to get in. Thank y'all for staying up late with us. It's been a hard week for me. I don't know about y'all, but it been a struggle. So, how many people we have tuned in? I don't really have anything on my
as of right
side.
now, can you hear me?
Yes.
Okay, as of right now, I don't see anybody tuned in right now because it's just 3 minutes in. So we'll give them a little while. No big deal.
Okay.
I would tell you that they have this new thing called background music
Mm-hmm.
where I don't have to play it through the laptop, but I can't hear it. So I don't know if it's working or if it's not working. It's saying that it's working. I mean, can you hear it? Because I don't hear none background music. Yeah, it was working beforehand. So I guess that's just a glitch that they got. But let's see. Um, what is why breast cancer month? I mean, I know it's the month, but why? Why bring attention to it?
Um, Hi Heather. Thanks for tuning in. I don't really know why they made October as the breast cancer month, but I mean, um, I know it's serious.
Mm-hmm.
And I know a lot of people, well, let me rephrase that. A lot of women's, um, I don't think they take it serious. You know, sorry to say, but special, the black ladies or
Mm,
the black women's, they go to the doctor when they have a child or when they probably get hurt real bad or something like that, but they don't take their life really serious when it comes to breast cancer and other things. So it's it's something serious.
yeah.
Um, I have had someone to have breast cancer in my life. Was She was my mother-in-law. Very special woman. Loved the heck out of her. She died of it. And I have an aunt that had breast cancer and she beat it. So, it's like an odd thing. But the thing is to be aware of what's going on in your body. I mean, I just had my mammogram. So you have to, every year, you need to get that taken care of. I think it's like 25 and up to get yourself checked out for the breast cancer and other things, women's exam. Um, as far as breast cancer or not, anything that you feel that's not right in your body is especially when it comes to your breast. They tell you how to examine yourself at home, um, how to just look at different symptoms, you know. So some women don't do that. It's like they get a pimple. They're like, oh, it's gonna go away. I put some toothpaste on there and it's gonna be good and clear.
Really? That's crazy.
Yeah, I don't know. You ain't never do that?
No, no.
Before they came out with what was that stuff, Stratex or something like that. Um,
For the pimples,
yeah, for the pimples.
I tried Proactive, but I was like, forget it. It'd be fine.
No, Proactive. I tried it and it like killed my skin because I used to have a bunch of pimples, bunch of blackheads and stuff. And I ended up getting it and I put it on. And I was like, oh, the first day I was like, oh yeah, this works. And the second day I'm like, oh, I'm clear. And the third day I was like bumping back up red. I was irritated. It was too strong. So,
Yeah.
but okay, I see that my
Somebody
chat
in the
line
chat
has something.
said, yes, breast cancer is very. Why can't nobody talk today? Breast cancer is very serious, and most people don't take it seriously. He also comes back and says most women start at 40, but if you have a history of it, they want you to start at 35. Kind of
Okay.
prostate cancer, then, right? For dudes,
I'm sorry, say that again.
or prostate exams, like if they have an issue with their prostates. That seems about the same.
Oh, as far as checking
Yeah.
for the breast
Mhm.
cancer. Yeah. Well, see, like I told you, I was trying to do some research on it, and of course,
Okay, no,
we
I
work,
got you.
work, 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 and
It's important to self assist. You have to be in tune with your body. Basically, saying the same thing that you saying.
yeah, yeah,
You,
you really
yeah,
do.
don't be afraid to touch on them. Make sure you're right.
Hello.
Man,
Um, like I said, certain things when you get, a certain age, yeah, the thing you want to do, when you first get your mammogram, when you, get your woman's exam, you want to get the breast check. You want to get your, your body check completed, like the women's exam, and the same thing they do for the men's. But some women's are sit up there, like I said, they'll go to the doctor when they have a child. They'll go to the doctor when it's down for STD or something like that, but they don't go to the doctor when it's time to have like the yearly or the annually checkup for them. So that's where we lose it because some people don't have insurance, some people too scared to go. Um, It's just a bunch of excuses that people make. And like I said, I hate to say it, but my black people, they do not take care of their body like they should. You have a lot of them that will, and you have a lot of them that don't. Well, now that we're kind of into this 10
Yeah,
minutes and 23 minutes, let
I
me
got a
explain to
video
you.
for you, but whenever you're ready, just let me know.
Okay.
And Heather says boobies for life.
So, um, like I said, my mother-in-law, she had this knot on her in her chest. And we was like, okay, it started off as a little knot. She was heavy chested. And I'm like, you need to get that checked out. And she was like, oh, I'm gonna go get it checked out. Okay. So as she says, I'm gonna get it checked out, I'm gonna get it checked out, then this knot be, became bigger. It had came like a golf ball big. And I was like, you probably need to go ahead and get it checked out. So she goes and get it checked out. They tell her that she have cancer. And we was devastated. I mean, I didn't want to say nothing because I'm not a doctor, but I just seen it just didn't seem right for the knot to go from, like a little bitty cyst into like something that's growing. And when I tell you that it was growing, it seemed like every month, then it was getting bigger and bigger. Um, so I think what she was thinking is that it would go away, or she didn't want them to like cut her breast off to save the cancer. So I guess she was scared. I mean, I can't really say how she was feeling mentally, but just physically looking at her, I know it was something that she was scared of. So, anywho, um, like I said, she finally went to the doctor. They told her that she had breast cancer and that they was going to have to remove the breast. So they removed the breast, and after they did it, it's like it went crazy. I mean, I think that's something that people are scared of too. Is that like they said, if you have cancer or something like that, then if they cut you, then it's like open up a wound. They get air to it, so it
Mhm.
makes the cancer spread faster than it would if you didn't open it up. So I was like, oh, okay. So I'm trying to think. It was what was the hurricane? It was Katrina that hit Louisiana real hard, right?
I believe so.
And then Katina hit us. Okay, I think yeah, the Katina hit us. Okay, so that year, um, she was going through chemo, and she was getting herself together. And she was, oh, look at my fingers, they don't turn black. I don't lost all my hair, and these people, they going through it. Like, I mean, I saw this woman go through it. She was losing her hair. She had, her fingers. She was saying that she was constantly burning. And I think the chemo was actually burning the stem cells that, to kill the cancer.
That was like a radiation treatment.
Yes.
Okay,
So,
probably would feel like a burning sensation.
right. So she, like I said, she, kept on going, and we try to keep on being motivated and everything like that. And she was talking about like some of her friends that she was hanging with, they passed of breast cancer, or they, it was something that was going on with them just having cancer that's probably in their body or whatever. So I think with her talking to them, or with her talking to people that had family members that had cancer, then it made her scared. I mean, who wouldn't be scared of that? Cancer is a silent kill. It's just like a stroke, a heart attack, they silent.
Yeah.
So cancer is I mean, me personally, just my opinion though, it's like cancer is worse than AIDS because it can come, be there for a minute, and then it can just spread around I mean over your body like within days. Um so like I said, she was taking, the treatments and everything, and we pretty much thought everything was good. And she was telling me I can't wish because if I say that name, then y'all would know my house nickname. So I'm not gonna say my house nickname. But anyway, she would call me this, and then she would put the Billy part to it, and I'd be looking at her like, okay. But she was after she kind of came to head with it, then she started being motivated. She started, being positive. She was just, like, hey, I'm going through this. I'm gonna try this. It's I'm good. So I was like, okay. And they let her come home, and she's like, oh, look, I only got one left, and I was like, oh, okay. And so they actually they give you these like people they lose their leg or their arm.
Hmm.
They give you like a little breast thing that can, be the same size as you was
Okay.
normally. So I was like, okay, you working it, girl. So she was, motivating everything. Her hair started growing back. She was, like I said, she was good. And then all of a sudden, it just did a U-turn. It did a U-turn. Like I want to say like a month. It could have been 2 months. It could have been 3 months. But it turned around so fast, and they had to put up in the. I'm trying to think of this. I know the name of it, but I say it wrong. Okay, it's hospice
Hospice.
hospital.
Hospice.
Yeah, that. So they put her in that hospital, and I would go down there and see her every day, and I'd be like, "Are you okay?" She's like, "Yeah, I'm good, but it's burning me. They setting me on fire." I was like, "What do you mean?" And it was them giving her the radiation,
Hmm.
to try to kill the cancer and everything. And oh my God, y'all, I think I freak out because at this time we're going through the Katrina, I forgot which hurricane it was. We're going through that, so they getting ready to tell people to evacuate from Houston, uh, to evacuate from Houston. So we all gotta go, and so we end up getting ourselves together and everything. She told me, she said they put me on a plane, and I don't told you this many a times. They put me on a plane, I'm just gonna die. And I was like, no, you're gonna come back. Everything's gonna be okay. She's like, no, I'm gonna die. So they flew her all the way to Atlanta. By the time she made it to Atlanta, she did die. She did die. Um,
Oh. Okay.
mhm. So, like I said, we, trying to come back, trying to get her back to Houston. Now, this the crazy part. They flew her down there, but we had to pay for her to come back to Houston.
Mm, that's crazy.
Yes, it was very crazy. So, anywho, she she actually died in the air. So they, after we got the report and everything, she had already told me like they put me there, I'm dying. I ain't, I don't do no planes. God was made for my feet to be on the ground. That's what I'm at. Like I said, she was a good spirit person. She was a loving person. But I look at her as she just ignored this knot in her chest. Women's, look at your body. Examine your body. Understand your body. Okay, Katrina. Examine your body. You know what I'm saying?
Thank you, Miss
Because
Scorpio.
you just gotta, I mean, you know things change. once, I mean, we get older day by day, and people don't realize that. So once she, we got her back home and everything, and we was trying to get all the autopsy what was going on. Um, oh, let me tell you this part. I gotta put this in here. So I had to. My father-in-law, he was like out of there. I had to go, and once they uh bought the bodies back, because she wasn't the only one down there. Once they bought it back, I go to the funeral home, and I go in this damn funeral home. This is what pissed me the freak off. I go up in this room, and they just had carts just on top of each other, just laid in there like they was mannequins.
The staging room. Yeah.
Yeah, but you supposed to have them on beds or like the little silver
Yeah, I
bed.
know the trays. Yeah,
Yeah.
yeah.
No, they just had them just stacked up like they was animals. I really got pissed off about that. So anyway, wait a minute, hold up, y'all.
You want to go through the chat real quick?
Yeah, go ahead.
Okay. Let's go. Last one that we had before was, let's see. Heather's like, it's crazy how tumors progress so rapidly. Yes, it is very scary, and cutting is supposed to stop it from spreading, but cancer cells can spread from primarily tumor and travel to other parts of the body before surgery.
Hmm.
Cancer cells can be too small to catch on the CT or the PET scan. And then Baby Scorpio says, rest in power to your mother in law. And then C does what she always does, make sure that our stuff is correct. And said it was the hurricane after Katrina Rosarita. So there we go. And we
Yeah,
are up. So if you would
great.
like, I found from Stratford Healthcare, Black women and the genetic risk of breast cancer. It's a young lady named Candace N. Thompson, a Black surgeon or
Hmm.
assistant professor, and it is about 39 minutes long. We don't have to watch all of it, but she pretty much covers everything of every other video I would have pulled. So whenever
Okay.
you're ready, just let me know.
So I'll get finished with this one. And anywho, like I said, she, we brought her back. She had a funeral and everything. But then that made me realize is that how much us black women sit up there and kind of put stuff on the sideburn versus on taking care of yourself. You know, um, nowadays, even if you don't go to the doctor, you can get on the internet and learn how to examine yourself and to make sure that it's nothing, no knots, no lumps, no. Um, I'm trying to think of the word without using the ugly word, leaking, dripping. Most people get. Well, I'm sorry, most women get that. Being pregnant or whatever, but it's just different science with that. So, with that said, we're gonna let you look at the video so you can get some more knowledge on breast cancer.
All right, and let me go ahead and share the screen. Yeah, if you have a question in the chat, you can put it in. I'll stop the video so we can address it. Also, Slim, same for you. Every once in a while, just pop in, give us your opinion. We'll keep it moving. And here it is, right here.
So thank you for joining again. I'm Dr. Candace Thompson. I'm a breast surgical oncologist at Stanford. I mostly have offices at Emeryville and Pleasanton, and then I operate at Palo Alto also. And thank you for taking time out of your Saturday to learn about breast health and breast cancer within the Black community. It's very important information. The seminar series is sponsored through Stanford Cancer Institute. I have a grant that is allowing us to do all of this once a month. And we are also in partnership with Touch, the Black Breast Cancer Alliance. They're a great organization concerned with Black women and breast cancer and clinical trials. And I'll be showing a short video from the founder of Touch later on. This is meant to be very interactive, so if you have any questions, just raise your hand, stop me. and we can go into detail about anything. So, just a little bit of history, things that we've already discussed that I think are important for each of these seminars. We know that Black women are 41% more likely to die of breast cancer compared to white women, and we have a higher relative risk of death compared to white women. We also have the highest mortality rate out of any ethnicity when it comes to breast cancer. Whenever we're diagnosed with breast cancer, we're more likely to be diagnosed with de novo metastatic disease, meaning whenever we first get whenever we're first diagnosed with breast cancer, we are diagnosed with cancer that's spread beyond the breast more often than other groups. We also have the lowest 5-year survival at 81%. And this one is important for today. We are just as likely as other groups, especially as white women, to have hereditary breast cancer and mutations that can lead to breast cancer. So that's why we're here today. We previously spoke about dense breast tissue, and we know that Black women are more likely to have denser breast tissue, which can lead to things being missed on mammography. And then we know that Black women have a higher chance of recurrence whenever we're diagnosed with breast cancer. And then when it comes to triple negative breast cancer, we're more likely to have triple negative breast cancer, which is one of the more aggressive diseases that's a little bit more difficult to treat. Also, we are more likely to get breast cancer under the age of 35. We're twice as likely to get breast cancer under the age of 35 and 3 times as likely to die from breast cancer under the age of 35, which is why it's very important to know your history and to know your family history and your personal risk. So let's talk about cancer genetics. So it's all a continuum. So I'll go over each of these things. The first thing is identifying your risk. So
All right. So before we go any further, do you want to touch on just the fact of just how more successful you guys are to it? And I know I said the word terribly wrong, but
Yes, that's what I just be trying to get people to understand because I was one of those people that I'm scared of needles. Okay, and then the people that know me know I'm terrified of needles. And yes, I know I got piercing and everything, but that's on a whole different level. When it comes to needles, you shooting something in me, I'm going to get the white coat nurse and I'm going to start sweating. But at the same time, if you want to live, survive, and everything, you need to understand your body and you need to get these annual checkups. I do understand that medical is very high. I mean, they is crazy. These doctors and scientists are making buku money off of just little pills that they probably made with baking soda. Just my opinion. I'm just saying. But they charging us like $300 for a 30-day supply. So people don't want to go through that because they can't afford the medicine or they can't afford a doctor visit. So with her saying, like the black ladies or black women's um is more likely to get breast cancer, I think it's because they don't have the money or the finance to go to a doctor. And if they do, like I said, they basically going to have a child or, maybe something that they need stitches or it's something other than just going in the hospital, I'm sorry, the annual checkup just to make sure that you are right, try to get it before something happened. They put stuff on the sideline, they wait later and it catch up with them. Now I'm curious about people that have or get breast cancer. Is it like uh the big size breast? Is it the medium size breast? Is it the small breast? Which one does have, I mean, who get it? It's not that. You have to check your family background. You have to check your family history to see if there's something that have, been in your family, or is it something that just came out? It's just, it's crazy. So let's get a little more knowledge on this, and we'll be back. Go ahead.
Raise of hands, who in here has undergone a risk assessment?
Also, if you got any questions
One,
in the chat,
two.
please be
Okay,
free to
about
put them
half of
in.
us.
Or you got any
And the
comments?
other half, maybe not so much. So let's go over what is a risk assessment. Does anyone know what we look at whenever we're looking to see whether or not we think you're at higher risk for developing breast cancer in general? Family history, that's a good one. Anything else? Age. That, yes, that's a factor in it also. Okay, so we'll go over. So these are the list of different things that we look at. So things that put you at a slightly elevated risk is if you started your period earlier or if you had late menopause. So that's why whenever you see your OB-GYN or
Baby Scorpio says breast cancer does not discriminate. So I guess it doesn't matter whether you have whatever size you got. It's
Yeah,
don't
big or
discriminate.
small, it doesn't, nothing discriminate.
So just like a dude,
Yeah,
don't
facts.
discriminate. It what it is.
if you do see a breast surgeon or an oncologist, that's why they'll ask you all of these questions. Longer time having periods, so earlier time with starting the periods and later menopause, that means that your body is exposed to estrogen for a longer period of time. So that can put you at a slightly elevated risk. Again, this group is the 1.1 to 2 times average risk. Also, if you had your first pregnancy after the age of 30, if you have dense breast tissue, if you've never been pregnant, if you've never breastfed, if you've used hormone replacement therapy or the oral contraceptive pill, that does put you at a slightly elevated risk. If you have obesity after you go through menopause, if you've had a fibroadenoma or some sort of hyperplasia within your breast, or if you've been exposed to alcohol consumption while you're in utero or when your mother was pregnant with you. No, it's any oral contraceptive use. They've found that there is a slightly
I'm gonna go back to that question so I can read it because they didn't have a voiceover for it, so I'm not quite sure um, why they did it like that. So the question was: is the risk associated with oral contraceptives only when used later in life? That was the question, and now she's answering it.
No, it's any oral contraceptive use. They've found that there is a slightly increased risk. It's not significantly increased. And there are multiple calculators that we use in order to determine your overall risk assessment. So this all goes into calculators that have been verified by research studies in order to determine whether or not you're elevated risk. So that alone wouldn't make you elevated risk. Good question. Other things that can cause you to be at a slightly more elevated risk is if you have a family history, which is why we're here today. So if you have one affected first degree relative, that would be your mother, your sibling, your offspring, or if you are known to have a genetic mutation, and we'll go over those different genetic mutations, that can also make you have elevated risk. If you have very dense breast tissue, if you had radiation to your chest previously, or if you have high estrogen levels after you've already gone through menopause. And then significantly elevated risk, as you stated, age is a factor. So as you age, your risk increases. Also, if you have multiple first degree relatives, so 2 or more, if you are known to have BRCA1 or 2 or any other high risk gene mutations, which I'll talk about all of those different genes because there is more than just BRCA1 and 2. Also, if you've had a history of carcinoma in situ, which we talked about at the last.
Now I was paying attention to her. She's giving me some more knowledge. I mean, I've have knowledge of actually being with people that have had breast cancer, but the knowledge she's doing right now is very education, ladies and men's, because y'all get breast cancer as well. But and it's kind of crazy what I'm going to say because after I was thinking about this, you know, the menopause is something serious. Um, they have this thing called pre-menopause. I did not know nothing about it. I thought somebody had peed on me, and I was 23, and I woke up just like hot, hot, hot. What's going on? Pre-menopause. So with that said, is that I guess what you're going through the menopause, and then you get up into age as menopause start like late 40s, early 50s for some people. It's just kind of like the period. I guess if you have your period early, then you'll probably end up going into menopause early, or maybe not. Not a doctor, just my opinion. But when you go through that menopause section, I think it does break your body down a lot because science or your body is telling you that we finna go ahead and break you down right now. But your age is telling you different. So oh no, I'm too young to have this. Just like baby Scorpio say, they don't have no discrimination on any disease, any menopause or anything. So that was very interesting, and like what she was saying is with the menopause and how your body break down. So that's another thing y'all gotta think about. Y'all gotta start putting yourself into that doctor's office and getting some more knowledge. Go Google this. Don't let Slim J just her opinion tell y'all what's going on with your body. Y'all need to knowledge yourself on this because the world is already crazy. And we don't need to be dying behind stuff that we can kind of control right now. So let's see what's got to give us knowledge on.
Talk or atypia, then those put you at elevated risk. Oral contraceptives are.
All right. So the question was, what type of contraceptives are associated with the increased risk for breast cancer? In case you are listening to this on the road, shout out to you guys on the rewatch. Make sure you hit a like for the algorithm. And if you're here now and you haven't hit a like, please hit that. Let's keep going.
Or birth control pills. The shot hasn't necessarily been associated with elevated risk, and IUDs, same thing, because they're more local and less systemic. Starting menopause early doesn't increase your chances because remember, the longer time period that your body is exposed to the estrogen and progesterone from having periods, that's what puts you at risk. So the shorter the period, then it doesn't put you at elevated risk. Good question. Okay, so let's talk about genetics. Can anyone tell me what the definition of genetics or what genetics is in their mind? Any takers? What do you think of when you think of genetics? Study of the genes. Exactly. Study of the genes and how they can be passed on to the family. That's exactly correct. So it's like you took the words off of my slide. Good job. So, so that's what it is. We're looking at changes. We're looking at the study of the genes, or how certain qualities or traits are passed from parents to offspring as a result of changes in DNA. So when we first took a look at everything, in 1926, the British Ministry of Health, they commissioned a study to look at antecedent conditions of breast cancer. And they looked at 500 cases and 500 controls, and they identified the risk factors that I spoke about before. And they also saw that there are some families and reasons that they couldn't explain in which cancer played havoc, and there are a lot of members of the family having cancer within the same organs. As you can imagine, this was done in 1926. The pool of people that they analyzed were mostly Caucasian. Over the years, genetic analysis has changed. Back in the 1970s, that's when they first started thinking about sequencing the whole genome, or looking at a person's whole entire DNA, which is a very rigorous process. It wasn't until pretty recently, in the 1990s, when they started the Human Genome Project, which most of you probably heard about. It was very exciting. We wanted to see what's going on in every single area of a person's DNA, and the thought is we can cure cancer if we know all of that. Well, we're still working on all of that, but we have identified several genes that are genetic mutations that are associated with elevated risk of breast cancer. So, why get genetic testing? So whenever you go to get genetic testing, I don't know, how many of you have undergone genetic testing?
This genetic testing thing. I got questions. Like, are you like predisposed to this? Like, is that what she's saying?
I'm assuming that she's going on like your parents, or like your grandparents, the family history.
Okay.
Uh, yeah, just to kind of see where things are, because um, when you go to the doctor, for me anyways, they ask you, have your mother, your grandmother, your great grandmother have had heart attacks, strokes, diabetes. They kind of cover all of that to see if it's something with you. Could it be like passed on through the genetics towards you? So they kind of like look at the history, and that's what I think she's getting at. It's like, if anyone in your family, as far as females wise, see if they had it, and you know, um, try to go on that.
Okay.
So
All right. You want to keep playing this one, or
yeah, we're gonna go a little bit more into that, and then we'll get down to the business. But she's doing a hell of a job. I mean, I
yeah? I
really
mean, I didn't know
I
none
really
of
like
this.
this clip.
I'm like a deer in the headlights for this. So
It's
maybe,
always good to know. It's
yeah.
always good to know. Knowledge is power.
Okay.
And it can also help you to help someone else, that's afraid of going through this, or even think they're going through something. You got to be motivated to people, because like I have told y'all numbers of times, we know we're gonna die, we just don't know how we're gonna die. But if it's something that you can prevent, as far as your health wise, to take care of yourself, then that's what you want to do. You don't want to, just like I said, go out um without trying to help yourself, and have people to have the knowledge of what you're going through. Because like I said, with my mother-in-law, I was so lost. um I was blind of everything. I'm looking at a knot that turned tiny into like big, and my eyes was like, oh my goodness, what? I don't know what's going on. I didn't know how to comfort her. I didn't know the words to say. I didn't know no knowledge of it. And again, I still don't have a bunch of knowledge of it, but I have physically, personally dealt with, people that have went through this. So knowledge is power. You want to get the knowledge and make sure you can help these people in their time of needs, because I mean, we can't. God got the last word. So only thing we can do is make them comfortable and try to not say the wrong thing, but do the right thing.
Like
Knowledge.
slightly.
Hmm.
All right, here we go.
Here. Oh, okay. Two. Okay, great. So, whenever you go to get that done, what did they do for you for the genetic testing? How did they get the samples? Okay. Yes. Yep. So it's a very simple blood test. Some companies will send a phlebotomist out to your house to get it done, and then they'll send it off to their lab. They'll analyze it, and then they will send your results back within 2 to 3 weeks. So it's a very simple process, very streamlined these days. A lot of patients are like, what does that mean? What's going to happen to my blood? It's sent off to the lab, and they analyze all of the genes, and typically it's a panel, and they look for anywhere from 50 to 84 different genes to assess whether or not there are mutations in those genes that have been linked to getting breast cancer in your family. There are also saliva tests for some of these companies. 23andMe and Ancestry don't really have the breadth of testing that these specific tests do whenever you go to the doctor's office. So those won't tell you like if you have any other genes other than BRCA sometimes. If it runs in your family, I highly recommend going to your doctor to talk about your risks so you can get adequate genetic testing. Now I'm just going to switch over to a video. This is from Ricky Fairley.
All right, and at this point, she's gonna go into like a actual story of a survivor. So I think
Okay.
we're okay on that one, unless you just want to watch it. So
Um. Yeah. Let's see what she's talking about. Let's if it get too long, then we will end it. And the people that's watching will have to just go and do their own research, but you will get some of the knowledge. So let's go for it.
Who is the founder of Touch, and she's talking about her story with genetic testing.
I was 55 when I got diagnosed with triple negative breast cancer. When I told my mom, she immediately cried, and she actually blamed herself. And she said, the worst fear I've ever had is passing breast cancer down to you. My mom was 50 when she was diagnosed with stage 0 breast cancer. But she didn't really think about cancer in our family until I got sick. And I said, Mommy, do we have anybody that we know with breast cancer? And then that's when it hit her that her aunt had died of breast cancer. And then I said, well, how did your grandmother die? And she said, a female cancer. And I said, well, what does that mean, Mommy? And she said, well, my mother didn't really talk about it. But that's typical of Black families. We just don't talk about health. And that's because a lot of Black moms or single moms are the breadwinners for their families. And so they don't want to talk about disease and tell people they're sick because they'll make them afraid that they can't take care of them. And we have to get over that. We have to know about who had a disease before us in another generation. It could help save lives and keep people from dying. So a year to the date that I was diagnosed, the cancer came back. My doctor said, get your affairs in order, Ricky, you have 2 years to live. And that was 10 years ago. So I'm very blessed. Black women under the age of 35 get breast cancer at twice the rate than white women. of the same age. So, my life's mission is to eradicate Black breast cancer. And it's really based on my 3.5-year-old granddaughter. The way I look at it, she's going to get boobs in about 10 years, and I don't want her to ever think about breast cancer. So I got 10 years to do this work.
What a beautiful story. What a beautiful story. That is a survivor. That was a lady that was determined. She did background on her family, that, her mom, her aunt, that's why I was trying to tell people, like, sometimes we have to just sit up here and talk about it. And she's right, about how Black people are, about their secrets of their health. Um, Now, I had an aunt. She was very sophisticated. I'm sorry, y'all can't speak. I'm so tired. Um, and she was always telling us, how to sit, how to eat, and everything. And I remember we went to her house one summer. I had been going to her house a couple summers, but I remember we was going to her house, and she was like, "Oh, I come here. I want you to tie this scarf around my head. I like the way you have your scarf." And it was, I washed my hair, took a towel and wrapped it, and she said, "I like the way you did it." And I was like, "Okay." I didn't think nothing of it, right? Because I always saw her, dressing professional. She always carried herself very well. And I went in her room, and this is like the first time I seen my aunt like not in professional clothes. Like, she was laid back. She had a robe on, just kind of like her little bonnet, just chilling. And she wanted me to show her how to tie her scarf on her head. Like the African people, they have the little, I can't remember the little thing it's called. And I walk in there, and I saw my aunt, and I was like, something missing. She only had one breast. And the way it was explained to me, she had been went through this surgery. She had been had this, cancer. She beat it. Didn't know nothing about it, because my family, they very secret, you know. So I had no idea of what's going on. I don't know if it was the breast cancer. I don't know what's going on. So I knew she wore a bunch of wigs. I just thought that was her thing. Some people don't like to wear their hair. They rather wear the wigs that they can just put on, fluff it up a little bit, shake and go. So I just, that didn't go in my head that that's what happened. So a couple years ago, I think it was maybe, I want to say maybe 3 years ago. I almost think it was that long. Maybe it could have been less than that. And somebody told me. Now, I do not have straight up information that that's what she had, breast cancer. But I can tell you she only had one breast, and she always wore wigs. She made sure that she stayed perfect around her family that whole time. And she lived to be, I want to say, 70 something years old. So, me being a young teen, it just didn't register in my head that this probably what happened to her. I don't know. But I just know that she had one breast. And when I saw her with clothes on, everything was stacked up firm. They was saluting. She always wore wigs. So I just never saw that downside of her. When she passed, it was saying that, but it was, like, let's say old age. Like I said, my family's very secret. That's the bougie family that don't want you to know nothing. Um, and I think that's selfish, because just like this lady said, her aunt had breast cancer, and she ended up getting it, and she did not have the knowledge of what was going on. And if she have not went and took care of herself with the annual Lee women's exam, she probably just would have waited or just probably would have like, oh, that's just a lump, it's gonna go away. I can massage it out. It's probably, if you don't,
It's a problem in the black community.
it's
Sensitiveness.
big time. It's big time. It's big time. Because like I said, you can't afford the health insurance. You don't want to stand in line for that freaking gold card um here in Houston. um you just it's a lot of things that turn you from it make you frustrated. Go stand in line for a gold card. Go do all this to get denied or turn away, or you get frustrated and just leave. But you sitting up there, you really hurting yourself because you do not know what's going on in your body. You did not take time to talk to people or your family members about what's going on. In my family, it's basically my great grandmother heart attacks, my grandmother strokes, and diabetic. Now that would be the second generation. I think they have my cousins that's over me. Most of them have they diabetics. You know, I think if we could have talked more about our health issues, other than seeing who got what or who's doing what, then it give you better knowledge on your health and how you can take care of it. And show your kids or friends or whatever, hey, take care of your body. Go get your annual checkup. And I hate to throw this in here, but I'm gonna do it any damn ways. You females, y'all can sit up here and go get these damn $300 ass bonnets on your head, the weaves, 500, $600 ass purses, shoes,
On it.
Nikes. I'm sorry, the bun. It's the sew in weave.
Oh, I
Yeah,
thought they were paying $500 for a
eh,
wrap. I was about to say that's crazy.
no, you can. Okay, so you got the hair that you can get weave in. Well, I'm sorry, sewed in,
I don't know none
and
of that.
just for oh, I know you don't, but just for that, it's like maybe you can have to get a full
Do we need to pull up a
body.
YouTube video? No.
To get a full body of the hair that you want, instead of to be thin, then you're gonna spend like maybe 600 to $900 for a hair because it's like just for the little bonnet thing that comes in there, it's like $300 or more. But if you can do all that, then you can take that money and go get yourself checked out. Shit, go to the doctor, go to the emergency room or whatever. Just tell them whatever. Like, oh, I'm hurting. I don't know. My just like baby Scorpio say, uh, the discharge in your breast or your breast versus something. You can get them to come in there and just check you out, and then that'll give you another knowledge of what's going on, and you can take it from there if you can't afford things because y'all scam on everything else. Why you can't scam on your health? You don't do it right because you too busy out here trying to keep up with the Joneses with the little tuna fish ass money that you have in your pocket instead of trying to keep up with your health. So I do appreciate that story that the lady did tell. Now look at her. They told her a couple months and she lived 10 years. She got a grandchild and she can educate her grandkids, grandchildren or whatever in this case. And that's what we need to do. We need to educate each other as families, as friends on cancer. And it's not only breast cancer for men's. I mean, I'm sorry, for women's. It's for men's too. Men's have it. I didn't know. It took me a long time. I forgot it was a. I think he was it Guns and Roses or it was one of those rock stars.
Hmm.
Forgot. But anyway, he didn't even know he had breast cancer. I mean, like people was not aware of men having breast cancer. People, think about it. We go through menopause, females, men go through menopause. We have periods and bleed, men's have period and don't bleed. So
How
this
you figure that?
it's just like I'm telling these people
His
about the
name was
knowledge.
Peter Crisis.
I'm sorry.
One notable rock star who battled breast cancer is Peter Crisis.
Was he from Guns N' Roses or, or what
He was
rock
from
band?
the legendary rock band Kiss.
Oh yeah, that's I'm sorry. Yeah,
And
you're
he
right.
was
Kiss.
diagnosed with male breast cancer in 2008 after noticing a lump on his chest while working out. He
Yeah.
underwent a lump syntotomy. Oh, I butchered
Hmm.
that. And he has been cancer free ever since then.
See,
But now he's being more vocal about his experience, raising awareness about male breast cancer, and encouraging men to pay attention to any unusual changes in their bodies. His story is a powerful reminder that breast cancer can affect anyone, regardless
I
of
hit the wrong button.
gender.
Sorry. See, you know what I'm saying? Take the time out and do the research with your family health, your family background. Like I just explained to y'all. You know, we got the heart attacks, we got the strokes, and we have the uh, diabetics in my family. So every year, I told you I hate needles. I went to the doctor. I had to give 7 pints of blood, man. The little tubes. I don't feel it. You know, I don't like that. But if it's something to help me to keep going, then that's just the thing I'm gonna take. Y'all get out here, y'all get these tattoos, y'all get, all these piercing, y'all get all this extra stuff. Get the knowledge on your body. Get the knowledge on your body because it's better, right? It's a lot better. And men's support your women's, or I'm sorry, support your woman.
Oh,
I know, right? Support your woman.
all that talk.
Support your woman, and with the help. I mean, because like I said, these people, these women's get out here, and now it's younger girls that's having kids. I mean, like, oh my goodness. At first, it used to be like, oh, they got pregnant accidentally. Oh, they got raped. Be okay. But now it's like they intentionally getting pregnant and everything. So therefore, they need to also go to the doctor to get things checked out. But they feel like, oh, I had a baby. They checked me out on this, that, that, that. No, 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 no. That's not necessarily true. That's not necessarily true. Because you can have a baby, you can be healthy as that, and then later on you can come back and, like the lady explained to you, you have a child, and it can be things that happen afterwards as lumps, with the discharge, all that. So it's y'all got to pay attention to your bodies. I don't know how to stress this. I don't, because I was one of those people that say, "Oh, I ain't getting no cold. I don't feel bad or whatever. I'm good." And then when I go to the doctor, I'm sitting up there like, "Damn, man." And then you know what I hate about the freaking hospital? Oh, when you go see the doctor, and you already kind of nervous and crazy, and then they're like, "Okay, we'll come back and we'll give your results a week or two." You feel make me wait freaking a week or 2 weeks for my result? Like y'all can't just go back there, put it in that machine, good, not good, or you can't do that. No, they make you suffer. So if you keep your health up and you keep going to your annual checks up, then you will have a better chance of kind of like, yeah, I'm good, I'm going that's okay. Well, you gonna give me a week or two? Okay, I'm good. Because you will be more comfortable saying I'm healthy because, like, I understand 12 months is a long time, but last year you was good. This year it may be like a little, your blood pressure is too high, or something minor that the doctor can give you medicine with, and it kind of fix it or lower it down. Versus is you've been waiting 5, 10 years to go to a doctor, and now this doctor telling you that uh you have an issue with your body, and been prolonged so long until now it's gonna take more medicine to get the thing done, or it's gonna affect you real quick. Just like Heather said, they said once they cut your body open and do the cut the cancer and everything, it's supposed to go away. But most of the people that I have talked to and been around that have had cancer, not just breast cancer, just cancer in general, once they cut them people body open, it depends on how bad it is, but it go real fast, and they take them out like real fast. Like they healthy this week, and next week they look dried up. They suffering. It's very sad and tragedy because we got to take care of ourselves. Oh, and another thing, and I'm talking about myself when I say this, because I pay insurance at my job for my health, my eyes, dentist, even my job give us like I don't know if they do it no more because I haven't paid attention. But anyways, they give you like free cleaning. I think it's like twice a year or whatever.
Yes.
I've been in my job 10 years and I ain't even seen that. I don't know. But anyway, yeah, I'm gonna have to go get this done. But don't sit up here and pay for something that you're not using. You know, use it. I had one lady at work that I knew. I didn't care if this woman got. I promise y'all, if this woman got like a bump, or she was like, "Oh, my eardrum was." It seemed like it's draining. I was like, "Damn, you stay at the doctor office more than you stay at work." You know, and I don't know why I even just said that to her, but it was kind of like funny, but not funny. And then I really didn't know how bad that woman was. I didn't know how sick she was. So, she had to stop working. She ended up she had like a stroke or something that she had at work. And it just, I didn't know. I just thought there was just something for her to get out of work. I mean, we used to work long hours. So I just thought, hey, you get a doctor's excuse, you don't have to come to work, right? But that wasn't the case. She was just really sick, and she ended up having a stroke or something that occurred at work, and she had to stop working. She can't much, work no more. So if it gets to that point where you not scared of the needles, or you don't have the white coat nerves like I do, go. Make sure you know what's going on with your body, because everything can feel good, everything can look good, but if you cannot look inside your body, you cannot tell what's going on with your body. Only thing you can say is like, "Oh, I feel good. I feel well," and it just break down. It just break down to that. That's I'm just I'm like all over the place with this because I'm just thinking about how many people I listen to about cancer, not only breast cancer, but just cancer in general. So y'all gotta be on point. Now, do you have anything else for me?
Only thing we got left is the closeout, the video that you requested me to pull, which is not a normal video that you would play over here.
Okay. Well, we're going before I do that. So, I told you about my mother-in-law that passed of cancer, breast cancer, and let me tell you about my aunt. Um, my uncle, he married this lady, second marriage. Well, anyways, she, you know, came out and told us. what's going on. And she even went live on Facebook. She explained what she was going through when she went to some of her doctor's appointment. She explained what she was going through. And it didn't look too good at first. I'm not a doctor, just my opinion. Um, she went to the treatments and everything. I forgot how long I think they was like about, I want to say a year. Could have been longer than that. Well, anywho's, um, she got to ring that bell. And if you don't know what that bell means, is when you have breast cancer or if you have cancer, period. I don't know if y'all look at those commercials about the little kids that have cancer and they done beat it and they can move on with life and everything. Um, she did it. She went through the process. She lost the hair. She lost the weight. She just went through the whole chaos, but she was willing to share with us and we was willing to just say this is what's going on, and we prayed for her. And a lot of us probably weren't there like we supposed to, but we had family members that was there and supporting her and everything. We all support her, just not right there with her, because we was trying to work and do whatever we can do. But right now today, that woman is so spunky. I think she just turned 69. She's doing good. She's doing good. I mean, she act like she's younger than me. But, I mean, she pulled it out. Y'all know what time it is. Train time. uh, can y'all hear that?
Yep.
Oh, wow.
Sure can. Choo choo.
But she pulled through. God bless her to make it through. She recover. Her hair grew back. Now, like I said, that's the thing about breast cancer. I, I'm not too sure about this, but I think once you have breast cancer, then like they remove a breast so they can like just get it away from you, whatever, and then they have to. I I'm not gonna say this right. Well, they have the false breast to be like yours, so you can still, you know, um, be full. You know what I'm saying?
Yeah, I got you.
Um,
I don't know how to say it no better than that though, but
I can't with I can't
prosthetic.
with breast. Yeah, they have it where they can make it to be level out as you was, you were. So anyway, like I said, she doing good. She be crunk. That's like that's one of my crazy aunts. She is crazy. She is messy. But hey, we all get it together. But I thank God that she did pull through. She was motivated. She did not give up. She did not let it get her down. The church was behind her. Her family was behind her. So I mean, that's what you need. When you're going through any kind of sickness, illness, you support them, because you don't know what they're going through. Everybody's scared of dying. I mean, if you're not, then okay, um, okay, that's cool with you. That's just how you feel. Um, but she, like I said, she's doing very good. Um, I when I was saying that, trying to say the about the process, I can't
Prosthetic.
get it. Can't, yeah, breast. I remember I was looking at I think the one was it Ebony, or no, it wasn't Ebony. It was a magazine. I was at the doctor's. Okay, they always spook you out. Why they always put them damn magazines in there that have like heart attack, breast cancer, AIDS, and all that? Uh, can we talk about the soaps or something? But anyway, they're gonna try to get you
Baby
to.
oil.
Oh no, they trying to get you the knowledge of what's going on and what can happen. And I remember this woman. She had got breast cancer, and they told her that she had breast cancer up in one breast, and she just said, you know what, the hell with it. I don't mind walking around with my shirt off and everything. And she got both her breasts cut off, and she She living, she doing her own thing. She just don't much care. I mean, like she said, she just want to feel free, and that's okay. If a person cannot take you or love you for who you are, you don't need to be with them anyways. And you also need that person that's gonna have your back and be your cheerleader, support you. Ladies, men's, get yourself together, go to the doctor, and get checked out because it's gonna be the men's time next week, and you know what that's gonna be about. But while we all up on the men's, what that P Diddy got going on? Why are y'all so into this man? Is he paying y'all to listen to his bull crap? Did y'all know y'all was so focused on him? Did y'all know the man that started stuff with him? Like the CEO or his the big guy. Did you know the two top people that had his back retired? I mean, I'm sorry, they resigned.
Yep.
They got they got the hell out the way. And people were so busy focused on P. Diddy. And so they didn't know that. And then you have this other thing going on. Like they almost start a war and y'all so focused on P. Diddy and his freaking baby oil. Like fuck I mean, excuse me, forget that. Let's focus on it can be a war going on. This can shoot our tail to the country or whatever. They have missiles. I'm not saying it right, I know. They can one little it could be a crumb that can drop on Houston and knock us all out the box. Don't focus on celebrities that not even I mean it's a good, entertainment, don't get me wrong. But don't focus on stuff like that too hard when you need to focus on your surroundings in your city, your town, your little your little circle. Don't focus too hard on that because it's too much shit going around just in Texas to deal with something that's entertaining y'all and trying to get your brain set on what's going on with that when they got missiles going in different little countries and stuff. They're getting very close. Very close. And I'm not one of them political people. I keep on telling y'all that. But when they were talking about some bombs and what was it that the airplane? Well, no, they had it was like a little missile. I mean, an air or a jet or something. They almost hit each other. You know what I'm talking about?
I'm not familiar with this one.
Oh, not the military person. But anyway,
Not familiar with this one.
yeah. Excuse me. So it was like this jet or whatever. They was doing some, I guess, like a practice or whatever, and they came like this close. Now if we would have hit them or they would hit us, because it was one of our people, but it wasn't us that try to hit them. It was kind of like a freak accident, but a freak situation. It wasn't an accident. But the thing was, they were so close. If they would have collided together, then they would have said that we were trying to blow them up, or we was. I mean, them was trying to blow us up. This gonna start shit just because. Pay attention to your surroundings. Pay attention to what your people that supposed to be running this state doing because I didn't want to agree with it, but yeah, look like y'all going to war. I'm gonna hide in my hole because I ain't really about to see life anyways. But like I said, y'all gotta pay attention. Stop concentrating on the baby oil and everything. I'm Johnson and Johnson had to come back some kind of way because they making all these relaxers that's giving people cancer and it's just it's like a domino effect. This is all hitting you know around this one person, Johnson and Johnson. Then you got the relaxer. The relaxer doing this, they lost so much money, had to pay so many people because of cause what? Cancer. All right. So now they're gonna get their stock back up on that with P Diddy with the baby oil.
You ready to play it?
Let's roll.
All right. All right, guys. We will see you next week. We're gonna play this one out, so this is gonna be the last thing you see from us. Please make sure you hit the like button, subscribe, the whole 9 yards, and let Slim know in the comments how she did on this right here, this breast cancer awareness month. You've been watching Just My Opinion with Slim J. So let's go ahead and do this last little bit. Let's see right here.
Me. Y'all ain't nothing without me. I made your asses. You can't fire me. Do you hear me? Do you hear me? Y'all can't do me like this. You ungrateful son of a bitches.